My name is Francis LeBouthillier, and I make high-fidelity surgical simulators. High-fidelity surgical simulators are medical models that surgeons will use to hone their skills prior to doing a very high-risk surgery. We've been developing a variety of surgical simulators and models, and some of them are used to teach the safe and appropriate use of forceps. One of the models that we are developing is used for teaching the implantation of a saline-filled balloon into the larynx of a fetus that's in utero. And some of the procedures are for early fetal development and diagnostic procedures, where they take fluid samples from the amniotic sac, as well as the blood cord sampling from a fetus in utero. As an artist, I have a skill set that I've developed. It's based on observation. By observing and then building what I see, I can make an accurate representation of that. So I use those skills in the developing of the medical models. Working up from a skeleton structure and building anatomical volumes and musculature on top of that skeletal structure, I can accurately represent a human being at various ages of development. The doctors use the medical models to hone their skills. They don't have a lot of time. They got to get in and they got to get out really quick. And so they practice the particular procedure over and over and over in simulation. So when they go in, the mother's not at risk, the fetus is not at risk, because they know exactly what they're doing. And that's our responsibility, is to make something that is highly convincing, that can present them with the challenges that an in utero situation will present them, and so they can achieve success without failure. The current work that we're doing involves developing fetal models from MR and CT scans. MR, as many people know, are magnetic resonance imaging, where they take an image moving through a subject thousands and thousands of times. So we're using special software for taking all those images and creating three-dimensional computer models. Those computer models are then resolved, and then we make molds of them. The molds are then poured into various silicone materials, and we're making very highly realistic three-dimensional silicone models for teaching invasive perinatal surgeries. The use of the 3D printer has been invaluable in our process. We've been able to make highly detailed models. In the past, I've had to rely on my observations as an artist and a sculptor. And the new technologies, using the MR scans and the CT scans and being able to turn that into three-dimensional prints, in a sense, takes the potential for abstraction, takes the potential for making something maybe a little more beautiful, or maybe a little more as I think it should look. And it gives us very hard parameters to stay within. The challenges involved in the work that we do is making things that have never been done before. The forms, the materials, the technology have been tried in principle, but nothing has ever come to the place that we have achieved in fetal simulation, to our understanding. The level of detail, the precision, and making software work that is not necessarily designed to do what we're trying to do. So there's a lot of learning and a lot of support from our team. Saving life through sculpture and being an artist and using those skills to help children live, it is a wonderful feeling, and I often reflect on the lives as I hear the statistics of the children that have survived using these particular procedures, and I am very happy with that.